Yes.
Hi, Mr. Barnes. My name is Dorothy Nelson. I'm going to be your nurse today. Can you tell me your full name and date of birth?
Right now, Divine Nelson Barnes, 072003.
Are you allergic to any
Cancer
medications?
land.
Have you had
I'm
an
sorry,
NG
I'm
tube
having a
before?
bad day. And yes, I have.
Okay. Did you have any reactions?
Nope.
Any reaction to the tape? Anything like that?
Mm-mm.
Okay. So what we're going to do, I'm going to wash my hands, put my gloves on,
Mm-hmm.
and I'm going to get started. I am going to measure the tube to make sure that we know exactly how far we need to place it in.
Okay.
Then I'm going to check placement. Once we get placement checked by me, we're going to send you to radiology, and you're going to have an x-ray to make sure that it's in place that way as well before you come back to the floor, okay?
Okay.
All right. Have you ever been diagnosed with a deviated septum?
No.
Had any nasal surgeries?
Nope.
Okay, so I want to check your breathing on both sides. I'm going to press this nostril. Breathe in for me. Any difficulty?
Nope.
All right, we're going to press this other nostril. Breathe in for me. Any difficulty?
No.
All right. I am going to lay the towel over your chest just in case you get sick because you have had some nausea and different things going on. That's the reason we're putting the tube in. I've got some lubrication here. I'm going to put that on the tube to help facilitate putting that tube down your nose and the back of your throat to your stomach. Is that going to be okay?
Yep.
All right, and then we'll irrigate it once we get done. So we're going to take our tube.
Mm-hmm.
We're going to measure from the tip of your nose to your earlobe. Once we get that to the earlobe, we're going to measure from the earlobe down to your xiphoid process. Is that all right? You okay?
Mm-hmm.
All right. So I've got how far we're going to measure. I'm going to put a little piece of tape here so that we know when to stop. You doing all right?
Yep.
All right. Let me put the lubrication on. We're going to make sure that we get that good and covered. All right, are you ready? Now remember, when you feel this in the back of your throat, we're going to pause. I'm going to have you do chin to chest, and I'm going to have you continuously swallow so it'll go down easily, okay? We're going to put it in this side. All right, you doing all right?
Uh-huh.
You feel it in the back of your throat?
Nope. Yes.
All right, tilt your chin forward, lift your head up for me. All right, and we're going to keep going down till we get to where we put our tape. All right, we're right there. I'm going to stabilize this before we check placement, okay? Is that going to be all right?
Yeah.
You doing okay?
Yep.
All right. Well, that piece broke. So here we're going to put that on your nose. All right. You still doing okay?
Yep.
All right. Now, we're going to wrap this around one side and wrap that around the other. Make sure it's good and in place. All right, move your hands on so I can get to the nose. All right, so we've got that in place. I'm going to grab my irrigation system. We're going to take the connector out of this side so that we don't break the seal. You don't ever want to put it in this side. I'm going to attach this. I'm going to put my stethoscope to your epigastric area so I can listen. Put that air in there. All right, we hear that. Now, in order to make sure for second placement, I'm going to allow the bubble to come back. That's going to pull that suction, and we're going to get some of your gastric fluids back into the tube. Once we get your gastric fluids, we know that that's second placement check. After that, we are going to irrigate, flush that tube, and send you down to radiology. You doing okay?
Uh-huh.
Any pain?
No.
Just a little bit of discomfort where we put it down the back of your throat?
Yep.
All right. But we're good and stabilized. If you feel like it pulls or anything happens, you just let me know, okay?
Okay.
All right, so I'm going to wash my hands. take my gloves off. I'm gonna go chart just so that they know exactly what we did, what size tube we put in, how you tolerated the procedure. And I will be back in a little bit.
Okay.
All right, thank you.